yeah, Dr. Mucklow is a great doctor. You know, I'm nervous, but I'm excited. I'm really hoping that this time it, holds, and this new procedure is going to be the success that I need it to be.
Hey, it's Dr. Mucklow. So you're going to be joining me today as I do a sacral fusion on the left side on this patient. You've already met her on the videos, and then you're going to see me actually perform the procedure. I'm going to go step by step. It's not going to be as efficient as I normally want it, but this is going to be a training video for you all to see how this is done and how simple it is and what are the safety things that we're looking for while we're doing it. We're going to be inserting some local anesthetic. I like to use an 18 gauge 2E, and I just enter into the joint on a straight up AP view. These usually pop in nicely. I don't even use contrast. I just basically putting a little 5 cc's of local into it, just to make sure I got some local in the joint for the patient. From here, now we have the S1 end plate squared off. We're going to oblique ipsilateral towards to the side of the surgery. In this case, it's left, so ipsilateral towards me. I'm looking to see where my first needle and my first Genesys needle is going to be entering through. I like to go lateral to the lateral line, which is the anterior sacroiliac joint shot. And that's going to be my entrance point plane, that it's going to be in this plane above the S1 foramen, below the S1 end plate, so in the middle or the body of the S1 vertebral body. And so now my target point here is placing my tip of my 2E needle just medial to that anterior or the posterior sacroiliac joint line. You can see that on the video over there as well. And in between the S1 end plate and the S1 foramen. The key thing about the Genesys is you have to know the directional unit of the Genesys. So this particular one has a marking on the backside which tells us which direction the Genesys needle is going to go into. So you're going to enter through that same hole that your 2E was in. We're going to go live and come down that same spot on the bone. And I flip the image over so I know that I'm on the same spot. And I'm having my Genesys going inward, so it's directed medially and not laterally at this point. Give a couple of taps just to insert it into the iliac crest. And now what we're going to do is the same contralateral oblique view. We're going to tilt towards the head. Sacrum, the superior portion of the sacrum. We want our trajectory to come in like this. Okay. Now we're going to insert our guide wire. Our guide wire has a small little mark here on the short end. That's how we're able to measure the size of the screw that we're going to use. The reason why I go live is because I want to make sure that I'm inside hard bone. So either way, if you get into hard bone, it's perfect. If you get into soft bone, then you got to be a little bit more careful and vigilant. So now we're going to do our little Sellinger's technique, leaving the guide wire in and taking we start doing smaller turns. You see in the picture that the guide wire is going through the iliac crest into the sacrum. It's going into the sacroala. Perfect location, that's strong, good bone for it to be in. And we're going to make our tract for our incision. Okay. So now in the contralateral oblique inlet view, we're going to go live again and insert our next Genesys, or the same Genesys that you may be using. And we're going to go and touch bone right there. And this here will also tell you the length of the screw that we're going to utilize. So typically on the top screw we use a 60, lower screw we use a 50 pretty routinely. But if you want to measure it out, there are 55, 65, 75 sizes as well. Now we're putting the working channel through. I take my forceps. The working channel actually has, before I put that in there, has teeth at the tip. So you don't want to drag the skin, so after you put that in, you can just kind of move the skin out of the way. Working channel in there, we have our guide wires coming out. Certain features, it's hollow. It's got fenestrations along it. You can see that the tip of the screw is triangular. It's a cutting type of screw, so it goes through the bone nice and smooth. It's barreled inside, so what that means is it's a proprietary type of screw that Genesys makes. As the screw is going in, it's pulling in bone to fill inside the screw itself. The screw also has two different types of pitches on the threads. on the bottom half of the thread and the top half of the thread, we see they're closer together, and in the middle half, you see that they're much farther apart. So this is the distance between the threads in the middle part, which is going through the joint, and then this is the distance, it's this just the size of the tip of my forceps on the top and the bottom. Why is that important? Two different pitch sizes are important for us to be able to create a compression effect. Once this portion or this pitch of the thread turns into the sacrum, this one starts pulling because of this thread count, thread type. The last thing I want to show is that the screw itself has texture to it. Why is that important? The reason why that's important is what we found is that bone will actually start growing onto this much, much faster than a screw that doesn't have any texture or is just smooth in nature. This is the 9.5 60 millimeter screw. We did put DBM onto it. The screw is attached to the screwdriver, which is attached to a T-handle. All made with certain things in mind. And now they're evened up, and everything else is just this rocking motion. It's like driving a Formula One car. Take the screwdriver off the screw itself, take that out, take this out, take a shot, and we have exactly what we're looking for. Normally it takes, from putting local anesthesia to putting the last screw in, about 16 to 17 minutes, and another 5 minutes for closure. Tube body came out really good. Just going to start closing this up, and that's the whole surgery.